Hello everyone. Today we're going to cover major depressive disorder. Before starting, I want to give you a striking fact about major depressive disorder. As you can imagine, depression significantly affects a person's life and health. But did you know that it is considered to become the second most important disease in terms of disability and premature death, second only to cardiovascular disease? Today I'd like to give you some information about major depressive disorder with the aim of better understanding what is major depressive disorder, how does it affect our lives, and how serious is it. I'll continue with the symptoms and signs of major depressive disorder. Then I will mention about the several causes of this disease, and I will finish my presentation with current therapies used to treat major depression. Before I go any further, it is important that I define major depressive disorder. Also known as clinical depression, it is a medical illness that causes persistent feelings of sadness and loss of interest. Most of us occasionally feel blue or sad, but these feelings are generally short-lived and pass within a couple of days. More than just a short time of blues, major depression is a chronic illness that usually requires long-term treatment. When you have depression, it causes pain for both you and those who care about you. It affects how you feel, how you think, and how you behave. Therefore, it can lead to a variety of physiological and emotional problems. You may have difficulties doing the daily activities, or depression might even make you feel as if life is not worth living. Major depression is a common but serious disease. In the United States, around 3.4% of people with major depression commit suicide. Also, up to 60% of people who commit suicide had depression or other mood disorders. In the rest of my presentation, as I mentioned, I will talk about the symptoms and causes of this disease. Then I will move on to the current treatments. Now let's move on to the symptoms of the major depression. Actually, those symptoms are very well summarized in a patient's testimonial. I want to read his own words. It was really hard to get out of bed in the morning. I just wanted to hide under the covers and not talk to anyone. I didn't feel much like eating, and I lost a lot of weight. Nothing seemed fun anymore. I was tired all the time, and I wasn't sleeping well at night. But I knew I had to keep going because I've got kids and a job. It just felt so impossible, like nothing was going to change or get better. However, people with depressive illnesses do not all experience the same symptoms. The severity, frequency, or duration of the symptoms vary depending on the individual. Now that I covered the description and signs of the major depression, I'd like to discuss what causes lie behind this disorder. Actually, depression does not have a single cause. Most likely, it is caused by a combination of genetic, biological, environmental, and psychological factors. Genetic pathways in the development of depression result in changes in the regional brain function. Those are two brain images taken from normal and depressed patients. As you can see, there's a quite big difference between those two. Also, risk for depression results from the influence of genes together with the environmental or other factors. And these include life experience, genetic inheritance, age, sex, brain chemistry imbalance, hormone changes, substance abuse, or other illnesses. Alright. I've told you why major depression emerges. Now I'd like to tell you how it is treated. 3 basic treatments are used to treat major depression currently. First one, psychotherapy or thought therapy, helps people interpret their environment and interaction with others in a positive way. It may also help patients recognize things that are contributing to depression and help them to change their behaviors. For mild or moderate depression, psychotherapy may be the best option. However, for more severe cases, it might not be enough. So, this brings us to the second treatment, which is medications. A number of antidepressant medications are available to treat major depression. And the effect of antidepressants are somehow superior to psychotherapy. There are actually several different types of antidepressants, and they are usually categorized by how they affect the naturally occurring brain chemicals to change your mood. For cases in which antidepressants or psychotherapy does not help a patient's depression, the third treatment, electroconvulsive therapy, might be useful. Before electroconvulsive therapy begins, a patient is put under anesthesia so that he or she does not feel the consciously electrical impulses given to his or her brain. A patient needs to take an antidepressant along with the electroconvulsive therapy. However, this therapy might cause several side effects, including disorientation, confusion, or memory loss. Although these side effects are usually short-term, sometimes they might remain. To summarize, we've just discussed that major depressive disorder is a common but serious illness. Then we talked about the symptoms and causes of this disease. And lastly, we mentioned about the current treatments used to treat this disease. The key point here is that do not underestimate the major depressive disorder. It is as serious as the other vital diseases. And please keep in mind that your mental healthness determines the quality of your life. That's all for today. Thank you for listening.